Hi, I'm Pamela Madsen, and welcome to another segment of Journey to the Crib. And I'm here with Dr. Dave Kreiner, who is the founder of East Coast Fertility. Thanks for joining us. Okay, so there's less drugs in my body, less injections. The cost is about the same. It has a higher success rate. So why isn't everyone in the United States doing micro IVF right now?
Well, let me just add one other thing.
One other thing, okay.
It's also less risky.
And it's less risky,
because
okay.
your risk of hyperstimulation syndrome from gonadotropins IUIs is 4 times as high as it is with the micro IVF. Your risk of multiple pregnancies is far greater with gonadotropin IUIs. It's at least 30% a chance of having a multiple pregnancy with a 5% chance of having triplets or more. You know, let alone the famous cases of the Octomom.
I got to go back to this again. So as far as I know, there's like 3 doctors in the U.S. doing this. Why? Why isn't everybody offering this to their patients? Do you have an answer?
Well, I think one of the main reasons why this isn't so popular in a lot of programs is it's not the highest pregnancy rate procedure that they can offer. The micro IVF is part of the statistics that is publicized on the internet. So when a prospective patient is reviewing the success rates of a program, they look at IVF success rates, and micro IVF is included in a program statistics. If the program success rate is 30% for micro IVF, well, as great as that is compared to insemination, it's less than it is for full stimulated traditional IVF.
You know, isn't it interesting how the CDC report and the SART report, which is, you know, was created to keep patients safer, sometimes works against us, because patients are so, doctors are concerned about attracting patients to their program, and so they don't do things that would perhaps, make them look artificially lower in success rates when that's not true. So it's actually kind of, it's really doing the right thing by patients, and perhaps in a roundabout way, not really being shown for that because of the reports.
Well, it fosters a competitiveness, because the programs want to look the best in front of their prospective patients.
Right.
So what a program might do is choose only to do those patients that have the highest success rates, and only do a full stimulated IVF, which will give those patients the highest success rate.
Right. So if you're an IUI patient, if you're seeing your gynecologist, and you've been recommended to do IUI, then you need to find a doctor who can talk to you about micro IVF. Yeah. Well, thank you. That was really...
It's a much more successful alternative to IUI.
Yeah. Well, thank you. That was really enlightening, and I wish it was around when I was going through this.